Yes, I can hear you, doctor.
Okay, all right. How are you?
Quite good.
Okay, right.
Mm.
Okay, so can you see the board here?
I'm seeing it.
Okay, right. So let's see where we
Mm.
stopped. Do you have a question for what we covered yesterday?
I think I asked them yesterday and they were clarified.
Okay, all right. Okay, so let's
Mm.
continue. So we are looking at the stages that we need to go through. Yeah, so we stopped on number 3. So number 4, we need to develop implementation plan. Okay. Now, implementation plan is
Yes.
easier if you have described the activities. So you have a number of series of activities. That's what forms the project. Yeah. So those series of activities, what you need to do is you need to implement them. So each one of them will take
Mm.
time, and some of them will actually be happening at the same time, while others they have to wait until the other activities is completed. Yeah. So, for example, if we had, let's say, we are building the facility for your dentistry. Yeah. So let's say the building where actually patients will be treated in. Now, if we look at that building, the house on its the building is on its own is actually an activity within that particular project. Now, to implement that particular activity, you will see it has also got a series of activities. So, the first, you need to find the place where you are going to build the dentistry. The second, you need to once you have found that place, you need to negotiate for the prices. So you pay the money, and then once you have paid, then the next stage is you need to make sure that you can actually make up bricks, and then obviously you have to make sure those bricks are ready, and then you dig a foundation. So each of these activities they need to follow in these sequences. You can't start building before you acquire the land. So in the same way, your project has going to have a series of activities. So whatever proposal you are actually trying to proposing for, whether it is a service or whatever it is, then you need to break it down into series of activities. So then implementation, you are saying, I will do this activity first before I do that activity. This activity and this activity can happen together. So that's what your implementation plan is concerned about. But also you need to look at the how long each one will take, but also what resources do you need for each of those activities. Now, it's important to break down them into this way, because then you are going to cost these resources you need to form the budget, which is going to be the next stage. Because you can't have a project proposal or have a care plan proposal without the budget, because we need to know how much money is required, how much you're going to spend. Now, if it's something obviously that involves going to make money, then we need to look at the cost that you have incurred versus how much money you're going to generate. So it's extremely important. The difference between these two is what it actually gives you the profit that it actually is actually expected by whoever is a part of the shareholders of your particular business plan. So here says provide a detailed plan for implementing your solution. So that's the solution you have. So let's say, for example, I think I gave yesterday quite detailed talking about the, so you have got dental caries, which is the problem. And you think that the reason why these children are having dental caries is because both the parents and the children themselves, they don't know how to look after their own teeth. Maybe they're not careful with the type of foods they eat. Probably they eat more sugary foods, or because they do not clean their teeth properly. So they need hygiene. So obviously, one of the things you need to have is that to make sure that obviously you're going to educate both the parents as well as the children. Their parents are important because they're going to help you in implementing the cleaning of the teeth for the by the children, because without them it's not going to work. But also they have to buy necessary things like toothbrushes, the chemicals they need to use. So what they need to use for cleaning the teeth. So all those they're going to be part of them. So detail of this is extremely important. And it says this include timelines. So that's what I was saying. These activities, the series of activities. So, for example, meetings with the parents first. If that's what is going to take place first, it is going to have time. How long is that actually going to take? How many parents are going to actually target? And then those parents, how many are going to meet at each time you meet them? How many times in a week you're going to meet them? And over what period you're going to meet them. Once you have met them, you have agreed, they have accepted, they have given you consent, that when you talk to children, you may need to convince the head teachers, and then the head teachers, then the teachers. So again, you're going to have a series of meetings trying to present to them the problem that you have identified, that many of the children are having a problem with their teeth. So those meetings require time. So all these, they are part of the series. Now, depending where you are, I'm not sure of the structure in Uganda, but in my country, you cannot do anything at a school without the consent of the what we call the school committee. So the school committee is made up of some of the parents, but also some of the politicians, as well as business people. Then the representative of the teaching department, but also representative from the Ministry of Education. So all these, they form what is known as a school committee. So this school committee need to know. So you consult the school committee first, and you need a permission from the school committee. And then the school committee can actually tell the school, allowing you, which means giving you permission to interact with the children. Otherwise, you can't come and just start interacting with the children. It doesn't work that way, but I'm not sure how it works in Uganda. So again, each of these series of activities, they are important. So timelines is important. From this to this particular day, I'm going to do this. From this week to that week, I'm going to do this. From this month to this month, I'm going to do this. So then what you do, you actually use the Gantt chart. So you put these in a Gantt chart, which allows you to see which activities are going to happen at the same time, and which activities actually need to wait until the other ones have actually been achieved. So you can actually Google Gantt chart. It's quite common. It's not difficult to look at. So I mean to find. So then those activities that you have, there's also known as network analysis, which you can use, which is more to do with a critical path. This. Oh, are you cut? Why are you knocking again? Hello.
Yes. Hello.
Hey, I'm wondering why you are knocking again. Okay, let's just continue. Probably.
No, the network was disturbing a bit.
Okay, that's fine. Okay, so then there is also called critical path analysis, and which obviously is called network analysis. So the critical path analysis helps you to look at the activities that you need to implement. So activities where you cannot actually have a slack time, which means they can't be delayed. They have to be finished on time. So if this is going to take 1 week, it has to be 1 week. But the others which have got a shorter time, those ones which are shorter time, it means they can wait maybe for 2 days or for 3 days or 4 days or 1 week. Now, that period is called a slack period. So do not worry going through those unless you need in your own project. Then I will take you through. It's totally a different thing altogether. Requires you mathematical skills in order to develop that. But it's enough to use Gantt chart. Majority of your project proposal writing, they require Gantt chart. So I'm saying you need a well thought out implementation plan will demonstrate your own preparedness. So you need to show that you are prepared, and also you are committed to that particular project. Now, the project in your case here is the services that you want to address, the gap that you found in the community where obviously there's a problem of decay among children, but these services are not available. They are not being provided. So that's the gap. The gap is what is available now and what is not available, which should actually treat this particular problem. Right. Okay. So it is also beneficial to outline the rules and responsibilities. So if you're going to include it, remember you need to also allocate resources. So these resources themselves, they are going to include people, so different groups of people that you need. So maybe you may need a nurse, you may need the attendant, you may need a cleaner, you may need a dentist. So all these, if it's obviously a project which you require collaboration, then obviously each group that you collaborate with need to make sure that they understand what their roles are. So in the same way, you explain what the role of these nurses are, what the role of cleaner is, what the role of a dentist is. You may need to want to have a secretary, which normally you call them receptionists. Yeah, so all these, you may need probably a clerk who actually will be taking calls from the prospective patients who actually are making inquiries, so need to respond to those inquiries. So whatever you put there, you must actually explain what their roles are, whether it is the group of people which are stakeholders, or it is the individual which are going to form part of your staff. So as it says, you need to have there's ensuring that there's a clear understanding of the expectations. So again, these people need to know what they are going to be doing, what their roles are. That is useful because you don't want to have arguments afterwards. Now, also, as I said, consider Gantt chart or other visual aids. This is extremely important. Other visual aids which are common, as said, is network analysis. But in your case here, probably don't, unless you are doing project management. If it will be required, then obviously you need to undergo totally different topic altogether. As I said, because they require mathematical calculations of the different time, how you calculate the time for each of them. Yeah, so as it says, visual aids illustrate the timeline and key milestones, as this can actually enhance clarity and engagement. So people will be able to understand what actually you are trying to do. Additionally, including...
Doctor, shall we have a chance to see the what the Gantt chart looks like?
Gantt chart, you can Google. If you Google Gantt chart, they are available everywhere. It's not something you can worry about.
Oh,
Yeah, if you can't Google it, let me know. I can find one and send it to you. Yeah, it's just you are just putting a series of activities. Did you not do project at school? Did you not do
okay.
dissertation
Okay,
project
Doctor.
at school?
All right.
Did you do project at school?
Yeah, I did.
Yeah, so
I did,
Mhm.
though these sides they are more theoretical.
Yeah, so the comment you are giving me is the same comment I had from the driver who took us to the airport when we went on holiday in Dubai. The guy was coming from your country and he was complaining about your education system, how your education system is failing.
Practicability.
Yeah, that he was saying the same comment you have made is exactly what he said. So he was saying, if actually our education has gone up to standard, that will obviously everybody who graduates will be able to help us. I'm sure our country would have been far much advanced. Yeah. Okay, if you experience a problem, don't worry. So try to find one, or I can send you one later on, and then look at it. If you need extra help, then I'll be able to help you. Yeah. Okay, so additionally,
All right,
include
Doctor.
contingency plan. So contingency plan, if this fails, then what are you going to do next? Okay, so always you need to have a couple of different plans. These are implementation plans. Yeah, so for example, if you are not going to have a cleaner, who else can actually deal with that cleaning job? Yeah, so extremely important. Probably you may have to extend the role to provide the role to your nurses. These might be junior nurses if the nurses are split into senior and junior nurses. So probably junior nurses can take that, or instead you may have probably someone who is just probably a care assistant. Yeah, so you may have to pick a care assistant instead of specific cleaners. So these care assistants can do both supporting the nurses and supporting the dentist, as well as helping to clean up. So as I was saying, okay, so outline how you will address any unforeseen challenges that may arise during the implementation. So that's what a contingency plan is about. Also, this is important because it shows that you are proactive, which means you have considered in advance. Yeah. Obviously, what obstacles you might actually find or meet. Now, meeting obstacles is not strange. Okay, it's normal, but the best is how are you going to overcome those obstacles? That's what is important. So yes, I'm going to identify these obstacles, but how am I going to overcome them? Yeah, obstacles are always going to be there, which we call challenges are always going to be there. So you need to develop ways of overcoming them so that at the end, your project will continue. Okay. Number 5, so we can see now include the budget. So if you did your implementation plan correctly, then budgeting is not difficult because all you are doing is obviously costing the resources that you have mentioned in your implementation plan. So for example, you need 2 dentists. Okay. Then these dentists, you need to decide how much money they're going to be paid in a month. And then obviously you multiply that salary by 12 to get how much they're going to be paid in a year. And then if your project is for your project,
Right.
your plan is for 3 years, then you multiply by 3. So that will give you a total budget for only that staff, the 2 dentists. Then if you're going to have care assistant, again, you do the same. How much care assistant is going to get in a month, and then multiply by 12, and then multiply by 3 for 3 years to fit that project proposal. And then obviously the same with cleaners, the same. If it's going to be the building itself, you do the same. So in the building, they're going to be different number of people who are involved in the building. So you add all these to form the budget, but you need this break it down. They need to be clear. They are showing. Okay. So it says present a clear and realistic budget that outlines the costs associated with your proposal. Include financial projections that demonstrate the potential return on investment for the partner organization. So it's the same. If this is a business, then we want to know how much you're going to make in a month, and then for a year you multiply by 12, and for 3 years you multiply by 3. Okay, that's what you need to do. Now the difference with your the difference that you have between a year to the next year. Now I'm sure it's the same in Uganda. People expect that you're going to have they're going to have increment at the end of every year. So you add 10% of what they are aiming now. Okay, that's what you need to do. So if for each subsequent year you add 10%, so the costs are not going to be the same every year. No, because the cost is only fixed for a year. At the end of the year, you review how much each dentist is actually earning, and then you add them 10% because they expect salary increment. Okay, so you need to include this. So which means it's going to be different for each year. So the same when you are working out the cost of materials. So let's say you need syringes, you need needles, these, or you need cords. These also the cost is going to be increasing. It's not going to be the same every year. No, it's going to be different. So you expect to have a smaller percentage of increase in the costs themselves. Okay, so that's important. So then if you're going to have a separate to show to people how much money you're going to make, then it means you need to look at it for that over period of a year, how much money you're going to generate. But it's important to show each year how much you are actually generating. In the same way, the prices of your services are going to change every year. So they are going upwards, not downwards. No, they're going upwards. So you need to consider that. And you put a note at the bottom to explain, or appendix at the end of your proposal to explain how you arrived at those costs, and also how you arrived at those prices. Now you may say, now how I'm going to work out these prices. So for example, each individual consultation, how much I'm going to charge. Now, how do you actually determine that? You need to look around the industry. So there are always industry figures. So look at the industry as a whole, or look at the competitor, some of the services that are already available. Find out. So maybe you need to find about 5 and see how much they are charging until you get the average. That's what we're going to use. Don't just use it from nowhere, because you need to justify why you are charging that particular price. Yeah.
Yes.
Okay. Yeah, I said be transparent about all the costs, including direct and indirect expenses, and provide justification for each item in the budget. As I said, obviously, it's important how did you arrive at that particular budget. Yeah, so if it's a totally new service, then you look at what the industry average is. If it was in the UK, it's easier because we tend to get these statistics from the commerce department. So they produce this almost every month to make sure that new businesses, they can actually learn from them in order for them to come up with the prices. But also you can look at the prices with your neighbors, which is the country which is closer to you. So you can look at their prices and then you compare, and then you decide how much you need to charge based on the income of your people. You just don't just charge the prices. You need to look at it. Can they afford to pay for it? Okay. But also, is it going to cover the cost that you're incurring and be able to make extra money on it? Okay. Yeah.
Yes.
Okay. Now, as I said, it may also be helpful to include a cost-benefit analysis. Now, this is only important if you are actually deciding to provide services that are supposed to be provided by the government. So you are providing services on behalf of the government. The government is not interested in the profit. No, it's interested in the how many people are going to benefit. Remember, they are using taxpayers' money. Okay, so this is the money we're going to spend. This is the number of people we want it actually to cover, or these are number of people we are going to cover with this money. So then what they do is you need to look at the total number divided by the total cost divided by the total number of people. That's what the cost benefit ratio is. So how many people are going to actually access these services, are going to use these services? That's what is important to the government. Okay.
Yes.
Yeah, I'm sure in Parliament you have heard it time and again. So if the minister says we want us to have a school in this particular area, and then they are going to be asking you how many pupils are going to attend that school, what's the total population of that particular area, how many children are there, what age ranges are there. So what they are interested is how much is it going to cost us to build that school. So they are looking at the total number of total number of children who are going to access versus the amount of money they are going to spend. So the cost benefit ratio is going to be the total cost that will actually be incurred to build that school divided by the total number of pupils in that particular area. Now, if the number is smaller, then it means it's not worth spending that money. But if the number is bigger, then it's worth it spending this money. So that's what cost benefit ratio is about, is how many people are going to benefit from that particular services. So as I was saying, it may also be helpful to include the cost benefit analysis that illustrates the financial advantages of your proposal compared to the costs. Okay? This can be particularly persuasive for decision makers who are focused on the bottom line. Particularly, not really the bottom line if it's services that is going to be provided by the government, because they are not interested in the profit. They are interested in how many people are going to be accessing those services. Remember, they will benefit by maintaining being actually elected again, because that's the only time that they get punished. It's the time when you are doing elections. When you are doing elections, they want you to show that this school was built by them because they funded it. But effectively, it's not by them; it's by people. Yeah, but unfortunately, all of us we think government is doing great things. Also consider discussing potential funding sources. Yes, where are you going to get money from, or financial incentives that may actually be available to support the project. This can further enhance the attractiveness of your proposal. Yeah, so it's the same way. How are you going to sustain if the government withdraws the grants? Are you able to to continue the project, or the project will actually end there? So you can see some of those alternative plans must be there. Contingency plans must be there. One of them is the government will not continue giving you grants forever. They will reach at a certain point where they withdraw their grants, or there's a change in the government, and they think your services you're providing is not important at all. Then what are you going to do? So, which means if they withdraw, then it means your services are going to collapse. But you need to find alternative way of how you are going to fund if the grants are going to be withdrawn. So, for example, you may think of probably asking parents to contribute. You may also ask to maybe the businesses around. Businesses, they are important because their role within the society is to improve the living standards of people. Remember that the community where the businesses is, they are there to serve this community with the products, and then they make money from this. But also in return, they provide services to people. So they provide services, they provide the products to these people, so the people benefit from it. But also the society provides them with the workers, because otherwise they wouldn't find workers there to work for them. So these relationships, they need to be really clearly, so the businesses can help to fund, particularly if we are talking about this dental. So it's going to help. They are happy to contribute to the development of the community, which is their social responsibility they need to have. So those are some ideas how you are going to actually continue or sustain your project after the government grants was withdrawn. If the grants for businesses, it's not a problem because you continue making money from it. So that money you use it to reinvest in the business to continue for the business to grow. So there's less work. It's only initial money that is important, which you need to make sure the bank will be able to give you the loan. Okay.
Yes.
Right. Then establish evaluation metrics. Yeah, we want to know whether we are succeeding or we are not succeeding. So what are you actually going to use to assess, to evaluate the success or the failure of the project? Yeah, these will also include the monitoring measures. Yeah, although monitoring people think is just collecting data. No, you need to actually try to understand that data. What is it showing? There's no point to wait until the end of the project and then obviously everything has failed. That's not right. So define the metrics that will be used to evaluate the success of the partnership or the success of that particular project or the success of your proposed solution that you are trying to actually provide. This section should outline how you will measure outcomes and ensure accountability. So who is going to be responsible to do that? And if obviously you are not achieving what you are expecting to achieve, then what do you do next? Yeah, that's extremely important. Now, obviously, it says clearly articulate the key performance indicators, which you hear time and again, KPIs. There are so many indicators that you can use, but what are the key ones? That's what it means. Those that are indicating whether you are succeeding or you are not succeeding. Yeah, so you use those to track, which means you're monitoring to see whether these are being achieved or they are not being achieved. You cannot actually have all the.
You cannot actually have all the.
What have you done?
Get us. Okay, so
your phone is.
what have you done?
Is echoing. I don't know why. Hello. Mm-hmm. Right. Okay.
Yes.
Yeah, it has started echoing. I don't know what you have put on. Hello.
Hello. Mm-hmm.
Yeah.
Right. Okay.
I don't know what you have.
Yeah, it has started
Do you use the headphones?
No.
So why is this starting echoing? I don't know. Right. Okay. So you need specific. Yeah. Don't use broader ones. So as I said, I think I explained yesterday. If you are going to look at the number of children who are having dental caries, then obviously that number needs to be getting down. So the children who are having dental caries should be getting down if you are actually providing educational intervention in those schools, or those numbers that are coming with those dental caries at the hospital. should also come down, because that it will mean that your solution that you have suggested is working in reducing the number of dental caries in this particular community or this particular population. Some indicators might be the amount of money you are making if this is a business, the amount of cost. So if it's a business, then we need to know amount of cost you're incurring each month. We need to know also how much income you're getting each month. And we want to know the profit, which is the difference between the money you're making versus the cost that you're incurring. So the difference between those two is the profit. The profit can be increased by reducing the cost. Increasing the price will not help you, because if you increase the price, then the demand for your services will drop. Yeah, the customers will go to different suppliers. So that's why it's very, very tricky to raise the prices. It's not always the best way. The best way is to reduce the cost, because the costs are under your control, is within you, so you can control that. But the price, no, it's not going to work. It doesn't. Okay.
Yes.
Right. Right. It is also beneficial to outline the process for collecting and analyzing data. So you can see the key performance indicators. It requires you to be collecting this data. And it's not just collecting it, you need to analyze it. Yeah. So it's not just so, for example, you are picking how many cells in a day. Those cells have to be multiplied by the unit price that you have. So then that gives you the total sales you have made. This is the total income. Now, this total income, you need also to see, in order to generate these sales, how much cost have incurred. So then you also need to have the total cost for that. And then you subtract the total sales minus the total cost you have incurred to come up with the profit. So this is the analysis. Collecting is just how many total sales have we made? Or you're just entering each time you sell specific service. So maybe today, this child came, it was just for assessment, and then it comes the next day, that day it is going to be obviously planning the treatment, and then it comes again, it's going to be probably taking x-rays and it's testing preliminary tests, like for example, is it enough hemoglobin if you expect that it's going to bleed, and then obviously then it comes again in a different day where you're going to do tooth extraction. So on each of these is going to have a cost, which is the price of that particular service that you are adding. So you are just collecting this for each patient. Then you need to analyze it. It means analysis starts by putting all of them together, and then obviously looking at the total, and then on each day also you're going to have a number of people who are working, and then you need to know how much you pay them per day. The same with the equipment you're using, how much depreciation for that equipment per day is actually incurring, and then you add them as the cost, and then you subtract it from the total amount you made from this particular patient, and then that will give you the profit. Okay. Yeah, so it's really important to see that obviously if you see different organizations, they are partnering with you, again, you're going to do the same. So if they're working on different tasks within your project, they are also collecting their own data. And one of the jobs you need to have is to collect them, putting together. So collecting everything together before you say, we are making so much. Okay.
Yes.
Consider including a timeline for evaluations. So when are you going to be actually conducting evaluation? And also reviews. Reviews, they are not towards at the end of the project. They can be in between. Yeah. Now you're ensuring that both parties are aligned on expectations for monitoring and assessment. So it's important to be doing monitoring. Evaluation in most cases, particularly in Africa, we tend to think that evaluation should be always at the end of the project. So what serves in the middle is going to be the monitoring process. So you may monitor at the end of the week, try to sit down, how everything is going on. If obviously it's not going according to plan, then it means you need to readjust, try to identify what is the problem. Why is it not going according to the plan? You can't wait until to the end of the project, maybe 3 years, and then you start evaluating and say, "Oh, it failed." Yeah, it means you have wasted a lot of money. If you stop after 1 week or after 4 weeks, then you have wasted less money because you had the opportunity to save the remainder of the money. Yeah. So monitoring is as important as evaluation, probably more important than evaluation itself. By establishing clear evaluation metrics, you can demonstrate your commitment to transparency and accountability, which can enhance trust and collaboration. So again, because it's a mixture of whether you are doing a project with other organizations or you are doing that project on your own. So this proposal we have to look at, it doesn't matter whichever. The only difference is that if you're doing with another group, they have a specific activity that themselves they're doing, which you call the role. Okay.
Yes.
Yeah. So that's what you will be looking at. Right. Okay. So tips for successful healthcare proposal. So what you need to do before you start everything, you need to research thoroughly. Okay. So very important. Okay. And you need to focus on making sure that your proposal is clear and also is precise. You are not just writing all sorts of different things. No, you need to be specific and make sure you are writing things that are relevant to your own project. You need to highlight unique value proposition. So what is the unique difference that your service is going to provide, which is different from what is currently being provided, if that service is there? So if the service is already there, then what's the difference between yours and the one you are actually, the ones which are already being provided and on the ground? So it might be as simple as yours is going to be more specifically targeting young people and in schools, while the other one, they just sit, they wait until the patient has got a problem, is coming with the dental problem. But you are taking initiative. You are trying to prevent these dental caries taking place. So what you are saying, we need to educate them before they actually engage in this. So in a sense, you do not want to wait until people have become sick and approach you. No, instead, you are taking services to the people. Yeah, instead of sitting and waiting for the people to come and look for the service. So this is you are taking preemptive action. So that can be very unique compared to those who are just they have just set up their services, and what they are doing is obviously treat people who have got dental caries. And even if they have dental caries, it's not always the case that they are going to come to hospital unless they have got pain. Yeah, if they have got pain, they are uncomfortable, or they have a swelling of the gum. That's when actually they go and they go to the hospital. But without that, they are not going to go there. But you are saying, no, my service is unique. I'm taking the services to the people. But also, I'm actually starting when these young people, they are still learning. They are in schools. That's the time that they need to have develop their habits. So what I want is them to have healthy habits, including not eating sweets, make sure they take the right amount of sugar, they clean their teeth every evening and also during the morning. So, or at lunch, after lunch. So you can see that you are taking preemptive action. You are not waiting until they are sick. Okay. Engage with visuals. We have already said, so you need to have the charts, statistics. You need tables of statistics, whatever you are displaying. So you need either tables of those statistics. So for example, the total number of population that you have in that particular area, their age range, breaking them into male and female. You're going to have also, you're interested to see their total income for the family, what are their total incomes are, because you want to make sure that you're going to charge the prices that are reasonable and they'll be able to pay. You also need to look at the visuals. It's going to be some of the things you need. So for example, you need a table of calculating the salaries for each individual for each year, and then the total at the end. So that requires the table. So the more relevant tables you put in your proposal, the better, because they can show clearly what actually you are talking about. But also, it helps the people who are going to evaluate your proposal that you have thought it through, so you are well prepared. You understand what is going on. Okay. Right. Okay, so what are really common mistakes which you need to avoid? Yeah, so obviously neglecting the audience. Now, what it means is that every proposal has a target group of people where you need to present it to. So it might be you're preparing this proposal because you want to present to the government for applying for government grants. So if it's applying for government grants, usually governments, they have got templates. So you need to have their templates. But whatever that template is going to have the breakdown of the things we have covered. So all these 6 steps, they're going to be there. How they are rearranged is different from one government to the other. So look for their templates and use their templates, but also try to see what they are interested in. In most of the government things, if you are going to deliver service that is linked to the government grants, then governments always, they have publication at the end of the year where they show things that they want to do, and it can be obviously on the inside section into the to things like, for example, they are looking at the manifesto, which they are saying what are they going to do. For example, in the government we have now in the United Kingdom, they are moving emphasis, the focus from treatment to prevention, which means they are more looking at public health. So if that's the case, it means you need to understand that this is what the government is actually looking for. And these are always published in their manifesto, and those manifesto, they are also translated by different departments. So in your case, it's going to be Ministry of Health. I don't know whether it's like in my country, it's called the Population and Health. It used just to be called the Ministry of Health. I don't know why they have put the population. So what you need to do is what is the current policies of that particular department or particular government. So check for those documents. If it's just about the schools, again, I have explained, then you need to look at who controls the school and what is their interest in that particular school. So that when you are preparing this proposal, you are actually making sure that it will attract their interest, because they need to support you, that the service you are proposing is indeed definitely going to help in terms of helping their young people to have healthy teeth. Overloading with information, yeah. So don't put information which is irrelevant. Yeah. So always ask yourself, how relevant is this? Who is going to benefit from the information that I'm putting in? Now, when you are asking the question who, you are looking at different stakeholders that are relevant to your proposal that you are writing. Ignoring formatting, again, this is what you did probably at your college, unless you're saying you didn't do much. So obviously, they tell you specifically in the same way you were doing when you had project management at school. They tell you what line spacing, should it be justified or not justified? How many words are they expecting you to write about? Obviously, if they are saying you need to write a report, it should be in a report format where you have headings, subheadings. If they prefer to have an essay, then you're not going to have headings. Instead, you have got paragraphs. Referencing is important. So both inside your proposal as well as at the end of the proposal, you need to write in the correct format. And all these little things you need to find out before you start putting the proposal together. And estimating the importance of proofreading, again, this was also useful in terms of your assignments. You were marked wrong if you don't actually proofread your work. So you need to check incorrect spellings, maybe grammatical errors. So all these, they need to be checked. Where do you put a full stop? Where do you put a comma? Where do you put things in quotes? Yeah, so extremely all these, they need to be looked at. If you don't look at all these, the is actually reducing the quality of your proposal. Then failing to follow up. Yeah. So when you have submitted your proposal, whether it's to the bank where you're looking for money, or it's to the government where you're looking for government grants, which is the funding, or to the international organizations who sometimes they fund the projects like UNICEF, USAID. Yeah, so you need actually to have a follow-up. So don't just submit it and thinking they're going to come back to me. No, give yourself time. Wait for maybe a couple of weeks after you have submitted, and then follow up with a call, try to find out whether they received or they did not receive. And then you ask, obviously, if they have received, when actually do you expect them to respond to you, so that if they don't respond by that time, you can actually call them again. If they have not received, then you propose to resend it. Yeah. Okay. So these are very, very important. Okay. So that's reality of what is required in this healthcare management proposal. Okay. Do you have any question at all?
Doctor.
Mm-hmm.
In case there is need for proof, as you've said,
Mm-hmm.
are we allowed to send emails of those people? For example, the medical director of the hospital, the administrator of the hospital.
Only if they are part of your group that you want to collaborate with, because
True, because they are the ones they are the ones in the management of the hospital under which we are supposed to operate.
So in your, I don't, as I said, I don't know the structure of your health system, because in your case, if you are seeking for grant, you must have a manager at that particular hospital where you are. So your manager need to know what you are doing with your boss, so the head. But if this is your own, then what you are interested is who is going to make a decision in terms of either sending that proposal to the many people who actually distribute funding. Otherwise, if you remember that these things can be stolen, yeah, it's important. You have to spend time on it, and the others can actually take that and use it for their own advantage. And then that is not going. So you need to be careful. Yeah. So you need to be careful who actually is why. You need to always ask the question, why should I send to this particular individual? If it's your government, there is a specific process you need to go through. So you need to check with the government documents, which actually explain how you can actually apply for funding. So if you're applying for funding, then you attach this proposal. Then obviously there's a specific person you need to direct your proposal to. It's not going to be everybody. It's not all the managers. Some of them are irrelevant. Yeah.
Because for me, on this side, my supervisor is the medical director
Mm-hmm.
as well.
Mm-hmm.
So there is no way I can pass through to do something without his knowledge.
Yeah, but obviously you tell him. So I don't know how it works. If you tell me how it works in your where you're working, so you have a medical director, then is this services attached to the service that are already available at that particular organization?
Yes, it is under that hospital. They brought it.
Okay, so if it's under that hospital, okay, so you have your medical director, then does the medical director know? Have you been able to sit down and discuss with that medical director? This is what I want to do.
Yeah, I've already sat and I'm trying to see how I can do it best.
Yeah, but did you have
because he's my supervisor? He's my supervisor.
Yeah, but did you have a word with that supervisor of yours that this is what I'm actually deciding to do?
Yeah, because they have been having camps, gynecological, pediatric camps. What I see, dental is not involved, so I also try to see how we can involve our department.
Right. Okay. So did you have the what to say? Did you have statistics that supports that obviously you are having people coming into that particular services, that particular hospital with these dental problems?
Yeah, the analytical report I told you about.
Okay, so you have this particular report that you have. Now, in each year, they are supposed to report to the government. They are supposed to be a report which shows how they have spent the money they actually got from the government. Do you get a budget of your own, or the budget is for all the services together?
It is for all the services.
Okay, so when the money come, so they have come. So from now, when they are asking for money from the government, they will, in their application, they are saying we have got dental services, we have gynecology, we have medicine, we have surgery, right? These are different departments within that particular hospital. Right. So they are putting it together. So they are going to look at the costs that is going to incur. So how many dentists are there? How many cleaners within the dentist? So you have a smaller budget. Do they ask you to work out on this budget? Because you would have your budget submitted to your director. The surgery would have their own budget submitted to the director. The other department also the same. And then they put the total that budget together, and then that's the total budget they actually submit to the government for money. Now, if they're not sure, they would call you to defend your budget that you have made. Do they do that?
Yeah, we make an annual work plan.
No, but the budgeting itself.
Yeah, and the budgeting, because from the work plan you can easily budget for the year how you are going to be spending, like that throughout the financial year.
Okay, so where you are now, so let's now concentrate on your department, okay, which is dentistry. Now, within the dentistry, how many different types of services do you provide?
Extractions,
Mm-hmm.
cementings or restorations,
Mm-hmm.
root canal treatment,
Mm-hmm.
prosthetics, prosthodontics.
Mm-hmm.
Then you have scaling and polishing or teeth cleaning.
Mm-hmm.
We have orthodontics or tooth alignment.
Mm-hmm.
Yeah, jaw apposition or jaw wiring,
Mm-hmm.
splinting
Mm-hmm.
or pachulectomy.
Mm-hmm.
Yeah, basically that, because we have less of the surgical procedures.
Okay, so you have 9 different types of services. So
Mostly.
so this service you want to introduce now, is this going to be new?
No, we just want to help those people out there who don't have the affordability to see that they have these services. Though there is evidence that those people have them, but they can't afford. They only have when they only come up when they have pain.
Okay, so do they pay now at your services? Do they pay for services?
Of course, they have to pay for consultation and then the service, for which most people can't afford.
Okay, so the services you already have, do they pay for them?
Yeah, they pay for each and every service.
Okay, so what exactly do you want to do with this proposal?
So for me, I see most people can't afford like having consultation and having those treatments being accessible to them because of the affordability and the money.
Okay, so
They are mostly people of low socioeconomic status.
okay, so do you have data that shows that the people with low socio-economic status they have less number accessing your services compared to those with higher socio-economic status?
Yes, because when they bring out normally the summary of the finances that we have made throughout the quarter or throughout the year, they are mostly people of insurance that have the affordability of getting enough of the services they feel like they like.
Okay, so you are
But most people on cash are mostly doing extraction.
yeah, so you are basing on the insurance, on the private insurance. That's where your data is based on. Oh, you have lost the